Well, I guess the answer is I didn't choose it. I happened upon it, as opposed to an active choice. So I started in college focusing on applied math and engineering physics. And then I ended up taking a course with Mike Posner. Many people know him as a well-known, now cognitive neuroscientist. And I did my honors thesis with him. And I really got turned on to psychology. So I changed my major from math and physics to psychology. But I always enjoyed working with precise theories and with mathematical theories and models and so on. So I didn't want to give that up. So, and at the same time, I really enjoyed thinking about basic issues and applied issues. I really wanted to work in some area that combined the two of them. So as my thinking developed and as I got interested in issues, this was just the most natural thing in the world for me to do. It wasn't that I decided, but it just fit all the things I like to do. I've never changed in that regard in terms of liking to think about matters in a precise manner and to formalize it as much as I can. That's never changed. What it's meant is that there's a lot of psychology that I don't really study as a consequence. And certainly it limits the kinds of issues I think about and the ways that I think about them. But on the other hand, I found that thinking carefully allows me to attack a whole lot of issues, and sometimes, ways that I feel very good about, maybe better than more imprecise or vague ways. Well, we certainly know from the early work by Paul Slovic and Sarah Lichtenstein and others that there are differences, right? So we know from their early work that lay judgments of, maybe not of uncertainty, but of risk, are influenced by how dreaded the outcome is, how abstract it is, in ways that expert judgments probably are not so affected by these things, at least not in their own areas of study. They may be an expert in domain A is probably influenced in domain B by the same thing all other lay people are influenced in domain B, I would guess. I don't really know that. That's just a guess. But certainly when experts are working in their own area of expertise, they know what the relevant data are. They know, understand the theoretical framework, so they know how to assess the data. So yeah, I think there are big differences. I also know, and this I know from my own experience working with experts on different topics. I mentioned the environment, but also some other topics. That experts usually don't like to give their judgments as opposed to their data. They usually don't like to give their judgments in numerical terms. And at least one reason why they don't like to give their judgments in numerical terms is because they feel they will be taken as more precise than they really are. So I think experts are very sensitive to degrees of confidence in their own judgments. And people like to receive advice numerically, but they like to give advice verbally or non-numerically or imprecisely. Well, I've spent a lot of time with colleagues, with David Badescu and many other colleagues. We've spent a lot of time looking at that. And one would think it does. We hadn't been able to find so many problems. So we've done a lot of research with people giving judgments numerically or verbally, receiving it numerically or verbally, looking at expected gains of decisions made in those situations, and we don't find enormous differences, surprisingly. And eventually we stopped looking for it. But certainly it's the case that people don't understand language in the same way. It's also the case that meanings of terms depend on context. So yeah, there's a whole host of ways you would think there would be communication problems. But we found it hard to really document them, even though I still think they must exist. Well, for one thing, I would urge the experts, unfortunately, none of them have asked me, but I would urge them to not be overconfident in their pronouncements. And there have been certainly examples of that in the United States. I don't know about in Europe, haven't followed it that closely. But in the United States, we have our experts telling us, they did tell us there's no chance of any transmission. We know how to handle this. We're on top of this. Well, then there was transmission. So immediately, trust, whatever level of trust there was in what the experts had to say, was reduced. And the more that trust is reduced, the less people are going to pay attention and believe what they're saying. This is a big problem. So it's perfectly reasonable to think that the chances of someone in the U.S. getting Ebola are infinitesimally small. But one could state that without stating it's zero and preserve trust. And I think this has been one of the biggest problems. Now, they're not using numbers, and that's fine. That's perfectly okay. But they were exhibiting degrees of certainty in the U.S. health system's ability to control this that just turned out to be wrong, and they should never have been so confident. I think it probably takes some training. So I'll go back to the work I did with the health experts for the Environmental Protection Agency. And it's not that these people were overconfident in this particular case, because they knew there was a lot of uncertainty what they were dealing with. For example, this was in the 1980s, the effect of lead on children's IQ. I mean, now we understand it pretty well. That time was very, very uncertain. The extent of anemia associated with uptake of lead, the extent of lung lesions associated with ozone, these things which are pretty well understood now were less well understood at that time. So it wasn't that they were more certain than they should have been. But, well, no, they probably were more certain than they should have been, but they weren't fully certain. And so what I mean by this is we spent a lot of time with these experts talking about sources of uncertainty in going from data to theory and from theory to the environment. So we spent a lot of time with them trying to reinforce the ways in which their predictions and expectations could go wrong. And I think this was helpful to them. And if we could do some of this with these health experts, pointing out to them ways in which past forecasts have gone wrong, ways that scenarios don't work out as planned, I think some prior training of that sort for people who are going to be communicating to the public could be very, very useful. I never thought about this before, but as you raised the question, these are the first thoughts that I have. Now, maybe next week I'll have some other thoughts. I'm pretty certain that I shouldn't be too certain that I've said everything right now. I don't know, you're taking me way beyond anything I know anything about. We know that the way questions are framed influence how people think about them. I suspect that most people don't spend a lot of time reflecting on uncertainty. That doesn't mean they don't react to it, but they don't spend a lot of time reflecting. I don't know that. I'm just imagining that's true. There could be data on it. I'm not familiar with it. Well, let me say a few more things. Most people are not well trained in probability, but not all uncertainty is expressible by probability either, right? There's a lot of uncertainty that we don't know how to quantify, and that is perhaps unquantifiable. So if we think about, I like to use the terms aleatory and epistemic uncertainty. And aleatory uncertainty is uncertainty associated with relative frequency data. Epistemic uncertainty is uncertainty associated with theoretical understanding or lack of knowledge. So the latter is not in any natural way expressible by probability theory. I know it oftentimes has to be for decision analyses, but it's not a natural thing. Virtually any sociopolitical event in the real world. Okay, if there isn't a natural reference class for it, and there almost never is, then the uncertainty associated with it is not aleatory, right? It's epistemic. You can only talk about aleatory uncertainty if you know what the reference classes are. So we think about ISIS right now. We make forecasts about the likelihood that ISIS will invade Baghdad. There's no reference class for this. There's no aleatory uncertainty. But lots of people have lots of opinions. And these opinions depend on how they understand current events, how they forecast what's going to happen in terms of, those groups, in terms of Western response to those groups, in terms of other Arab countries' responses to those groups. And so people take their theoretical understandings and they make some types of imprecise judgments about the future. None of that is aleatory. So even if one has to express it probabilistically for the sake of expressing it, they're not probabilities in any real, in any relative, I don't want to say real, I don't like that word, any relative frequency sense. It may reduce it, it may increase it. And maybe either is appropriate given the situation. So I think the literature is kind of mixed on this and is right now is at a kind of exciting point. So on the one hand, we can argue that, or we know that there are situations in which independent judgments are better. And then, particularly when we look at wisdom of the crowds phenomena. So let's just talk about that for a minute and then come back to the broader issue. So in terms of wisdom of the crowds phenomena, where averaging judgments tends to lead to better results, more accurate forecasts or predictions than most or all of the individuals. That's a case where independence, so no interaction is good. On the other hand, there are situations where when people interact with each other and they bring perspectives to each other's thinking that they didn't know about, that the interaction can lead to better results. So, I'm doing this, engaged in research right now as part of the Good Judgment Project, or this was the, what do they call it? ACE, Aggregative Contingent Estimation Program, sponsored by the US IARPA. And Phil Tetlock and Barb Mellers and their colleagues have done work looking at teams versus individual judgments. And these have to do with forecasts of sociopolitical events. And they have found, much to my surprise, that teams on average tend to do better than individuals when they can interact with each other, at least under controlled conditions, or interact with each other through the computer, not face-to-face. That their interactions have not been face-to-face, but through the computer. And these teams seem to tend to filter out information that may be irrelevant and focus on relevant information. Overall, whatever the reasons are, they do better than the individuals. So I'm sure research will show that we'll begin to delineate the situations in which teams are better or worse than individuals. Certainly we know that if everybody has the same information, not interacting is better. I think we can say that unconditionally, because then what you want to do is average out the noise. And when people have individual pieces of information, and maybe just averaging is sufficiently good. And ideally, Diederik and I have a paper in which we show conditions under which averaging independent judgments can lead to very high diagnosticity. you need to think through you need to query yourself on your relative values. You need to query yourself on sources of uncertainty. How likely are scenarios that you hadn't thought of? Try to think about scenarios where things will go wrong, and you need to do for yourself what a group might do for you. I think there are good examples where I took the opinion of a group into account, but not in any formal sense. So I was department chair for quite a number of years, and I always had opinions. And I would go into a faculty meeting, or I would discuss with people. I would usually lay the groundwork about how I think we should do things. And I would have my reasons and so on. But I always remained open to what other people thought. And by the time we got finished with these conversations in committees or faculty as a whole, either people were really on board with what I wanted to do, or I recognized why what others wanted to do was better. And we would go with it. So I never was dogmatic about it, but having a discussion of that sort really would bring the group around to a decision of one sort or another. Oftentimes what I wanted to do, but not always by any stretch. And there were some times when I realized what others wanted or what the group wanted was better than what I thought. There were some times when I thought, no, it wasn't better, but I'm not going to make any headway here. So let's go. And then there were times when they said, yeah, that's a good idea. We didn't think so beforehand, but yeah, that's a good idea. Yeah, so I'll give you a positive and a negative answer. So here's the negative answer first. That when we moved from Chapel Hill, North Carolina to Maryland, when I moved from UNC to the University of Maryland, we had to buy a house. We didn't have to, but we wanted to buy a house. And the housing market was really tight at that time. It was just impossible. So for every house, there were 5 or 6 people making bids. So in the end, as I was told friends, people put more thought into which apple they were going to buy than into which house they were going to buy, because they had to bid so quickly. So at that time, I was president of the Judgment and Decision-Making Society, and I had to write a president's column every month for the newsletter. And I wrote one column on how, observing myself and my wife and I, we violated every known model of decision-making. There was no known model that applied to what we were doing. And it was a pretty important decision. So, you go in, you look at a house, there's 3 or 4 other groups looking at the house, and then we have to go right out and make a decision, do we want to buy this house or not? We violated all known models of decision-making. We're violating principles of transitivity, for example. So we would compare houses A, B, and C, and we would think about all the different dimensions that the house is varied on. And so we would prefer A to B for this reason, and we prefer B to C for this reason, and then we prefer C to A for that reason. And I saw us doing this. We knew we were doing it. So my training helped us to get around the problem, but we surely were doing it. And this happened because we were trying to compare houses on different discrete factions. So every time we would think about features of the houses that were important, that would alter our rank ordering of the houses. That's pretty much the main thing that was going on. And we just had to take a deep breath and stand back and say, okay, we just have to think about this more holistically. And in the end, we bought a house. So there, what my training showed me was what I was doing wrong, but I couldn't help myself. Another example where I think that my training helped was when I was helping my father, this was many years ago, trying to decide whether or not to have an operation. So this is kind of interesting. A lot of decision analysts have this same experience I'm going to describe. So with my father's physician, we worked out a decision tree. What are the different choices he would have? What are the consequences of the choices? And we had a tree maybe 3 or 4 or 5 levels deep. And the physician put all the probabilities on the tree, and then I helped my father to get utilities on the tree or values by asking him how much more important one thing is to him than another, and various ways to try to get, numbers on the tree. And so I would never have done this if I didn't know all about this. And so by the time we got all finished, it was clear what choice he should make based on the tree. Well, my father didn't really give a damn about the tree. But having thought about this so carefully, he knew what he wanted to do, which happened to be consistent with what the tree said he should do. And I think a lot of decision analysts, I'm not really a decision analyst, but a lot of decision analysts have had this situation that when you help people think through the outcomes and consequences, by the time you get all finished doing that, they know what they want, regardless of any calculations. But the process of separating out probabilities and outcomes, values of outcomes, is really helpful. I think people can improve. I'm sure they can. Will we improve? Well, I hesitate to make a very confident forecast, given everything we've discussed for the past, whatever it's been, 30 or so minutes. I think it would be great if every student would have a course in probability, but I don't think that's sufficient by any stretch of the. I just think people need help in thinking about data and statistics. But then I also think people need help in going beyond that, recognizing the uncertainty that's not so easily quantifiable. And I think in complex cases where there are really lots of perspectives that are worth taking, lots of sources of information, in particular when we think about real-world events where there are so many factors that affect these events. If we can learn how to have some structured discussion on them, that would be very useful. Will that happen? I'm not going to predict.